So thank you. I'm going to talk about various issues related to minority stress, in particular the more conceptual issues, and then the research aspects, and then our research evidence, and then some discussion in terms of where we go from here, and I would love to hear your comments on that as well. Recently in the United States, we were lucky, I think, is the word, to have the Institute of Medicine publish the first ever report on the health of sexual minorities. And this is an important document for the U.S. in particular, but I think beyond, because the Institute of Medicine is a very respected organization. It's a nonpartisan academic organization that is charged with recommending health-related policies and issues and funding to the U.S. Department of Health, HHS, and other organizations. Of course, it doesn't have any mandate in terms of forcing any of this, but it's a very respected institute. So beyond what it just says, even the fact that it has published this report is important for those of us who work in health. And among the things that they said, they identified four areas or four aspects of research, including the life course perspective, intersectional perspective, and social ecological perspective. And they also identified minority stress as one of the perspectives by which or through which to assess and to study the health of LGBT populations. So I'm going to talk, when I talk about minority stress, about two different types of general areas that we can think of where stress affects LGBT people. The first, of course, is the structural stressors. And by structural stressors, we mean anything that is in the environment. Marina mentioned heterosexism, things that are not necessarily affecting or not necessarily about interpersonal interactions. So structural include, for example, we are in the midst of a very important, I think, marriage debate and activism. And I say it's important because, not because I think necessarily marriage itself is so important, although that is definitely important to many people, but because, and I'm mentioning this because I've heard all kinds of criticism of the marriage, that is not an important thing, and that's kind of about mainstreaming LGBT people. I think that is the wrong perspective to look at the marriage issue. For me, the marriage issue is really about equal rights and about eliminating stigma that is structural in the sense that it treats gay people's relationships differently than it treats heterosexual people's relationships. And in that, I think it's a very important fight to have. And many other reasons. But structural stigma relates to the fact, as we see on the top map of the few states, New York has just been added and is not on the map, that actually do have gay marriage, but on the bottom of the map, all the states that have not only do not have gay marriage, but have either law or in the solid color constitutional amendments that ban gay marriages. So to see this kind of map, to me, it's one thing to not have the laws, but it's another thing to go out of your way and create laws, and not only laws, but constitutional amendments to specifically say that gay people should not be able to marry. So that's an example of the marriage debate. The case that I testified in was called Perry v. Schwarzenegger, and it's called Perry v. Brown, the governor of California. And in that case, the judge issued a ruling that said that kind of constitutional amendment that bans gay people from marriage, as was enacted in California through Proposition 8, was illegal in the United States because the U.S. Constitution affords everybody equal rights. So this was a very important equal rights decision. Again, as I said, it is not about marriage, it's about equal access to the institutions that are provided by our social structures. And the judge in particular said Proposition 8 fails to advance any rational basis in singling out gay men and lesbians for denial of a marriage license. Indeed, the evidence shows that Proposition 8 does nothing more than enshrine in the California Constitution the notion that opposite-sex couples are superior to same-sex couples. So this is what I'm talking about in terms of the stigma, one example of stigma that is enshrined in our social system. The other type of stigma is enacted through interpersonal relationships. And by that I mean both one-on-one kind of encounters, but also interpersonal relationship in the sense of maybe an employer affecting multitude of employees. So it's not just like two friends or two people on the street. And there are various areas where interpersonal stigma is enacted. And those include major life events, chronic strains, minor events, and non-events. And I'll talk a little bit about, in particular, the last two, because the first two are the kind of thing that you kind of guess, can imagine. A major event is something like being fired from a job. So being fired from a job is a very significant life event, and many people get fired from a job, of course, especially recent years with the economic recession. But the point here is that people who are in a social minority, such as gay and lesbian people, blacks in the United States, and many other groups, unfortunately, are subject to the risk of having this kind of event, not only because of the reason that anybody else would, but also because of discrimination. So they have an excess, as we would say in epidemiology, risk for this event to occur. And that excess risk places them, we think, at excess risk for disorders that are related to stress. So I'm going to go back to that, but this is the basic idea behind the minority stress theory. And chronic strains are the things that are chronically happening, where, for example, not being able to marry if you desire to marry, and if you're suffering from the effect of not being able to marry through family relationships, through schools where you have children there, or through visiting your partner at hospital. Those are the kind of chronic things that happen day in and day out that affect people, and again are related to, in this case, stigma and prejudice. But the more minor events and even non-events are the things that we don't usually think about. And as it turns out, they can be very, very impactful, sometimes even more so. In the Perry case, when I testified, those are also called, by the way, daily hassles, everyday discrimination, and microaggressions. Can I use that other thing that walks around? So, in particular, in the Perry case, the plaintiffs were two gay couples, and they described various ways in which they suffered from the experience of discrimination. And after they testified, they were kind of made fun of by the lawyers for the other side, by they're called defendant interveners, the proponents of Proposition 8, because they described such silly things as having a problem with the form. And my point here is to say, as I did at the trial, that filling out a form is really a minor and mindless even event for most people, except when it reminds you of something that has to do with the core of your existence and the core of your rejection and discrimination in a society. So, for example, Sandra Steer, one of the plaintiffs, said, well, doctor's offices, are you single, are you married, or are you, divorced even? But, I have to find myself, scratching something out, putting a line through it, saying domestic partner, and making sure I explain to folks that what that is to make sure that our transactions can go smoothly. So if you were filling out a form and the form had some kind of clerical error and you have to fix the form because the name or you didn't, and you scratch it out, and you wouldn't remember that years later. But having to fill out a form And as she said, what impressed me, having to find myself. To me, that was kind of, as a psychologist, perhaps a clue to the significance of this from well beyond the minor, the seemingly minor type of annoyance of having to scratch out husband, wife, and write domestic partner. So there are things here that are significant because of the meaning and also because of what they remind us of. They remind us of years of rejection and discrimination that is symbolically represented in this little form. Other examples having to do with explaining to people what it means to be domestic partners, and through that having to come out basically to anybody that you really don't need to get into this discussion with, which is also very stressful because you don't need to get into a discussion of your relationship with every single that you meet, and that's distracting. But non-events are another type of stress that is really about things that didn't happen, that you expected to happen, or that should happen, or that most other people expect should happen to you. And those types of things have to do with something bigger than just having something happen to you, but really, as Hans Selye, the kind of grandfather of stress research, described, just living in harmony with your environment. And in a study recently, I tried to get, this is a study that I conducted in New York on gay, bisexual men, lesbians, and bisexual women, and heterosexuals. And in this particular paper, we wanted to look at that non-event. And we were really stymied by how do we ask people about things that didn't happen to them that maybe should have happened to them. And we came up we had many meetings discussing this. This was actually a tiny part of the study, which is mostly a quantitative study, but we also included a small qualitative portion. And at the very last part of that qualitative question, after about 4.5 hours, by the way, that people talked to us, we asked this one question: what do you think your life would be like without homophobia, racism, and sexism? And we thought that through that we're going to kind of evoke people to think about the what is called the counterfactual. What would it have been like if I wasn't exposed to stigma and discrimination in my life? What kind of things would have happened to me that are different than what actually did happen? And we identified, as I said, this was a qualitative portion, and we identified 3 themes that were describing a lot of those many issues that I think will sound familiar to people. The first one was lost opportunities. So because of stigma and discrimination, people didn't get to do certain things that they would have otherwise been able to do. The second one was a huge theme of safety and freedom of expression, as people recalled, which is just the ability to be safe as you walk down the street. And I'll give you more example. And the third one is something we call positive marginality, which when we asked this question, I don't know what your reaction was when I just read this question, but when we asked the question, and as I said, after a very long interview, people were kind of like, wow, that was a very common response, wow. Because it's hard to imagine what your life would be like without homophobia, racism, and sexism. And as I said, we had people of different races and both men and women, so people may have picked up on one or two or all of those aspects of it. But they were like, I can't even imagine that. But then later, as they spoke about it more and they talk about those other 2 themes and as well as others, then they said, well, you know what, I don't even know if I would have wanted that to be the case, because so much of who I am is related to homophobia, racism, and sexism. And in many ways, those are very good things of who I am. Those are things that I like about myself. So that is called positive marginality. So some examples of that, and we gave a title to each of these things using a quote. So one was, which I thought very poetic, and if not said a little bit, somebody said it would probably be at home. And that's an example of many people who describe, like this Latina woman, I would have gotten different education, my neighborhood would have been different, everything about my life would have been completely different. And that was a common thing. People who left home early because they had to go to New York City in this case because they were afraid of harassment or because they were harassed. And they literally left their home environment sometimes to not have many contacts anymore with that. So that was I would have still be home. This one was I would be louder, which was about safety and expression, but I like the idea of being louder, like being able to talk. And this is an example of a black man who said if society was more tolerant toward us, we wouldn't just have to go down to the village and hold hands. We would walk down the streets and hold hands. I look for that day when you can just kiss your partner on the subway or at the bus stop or on the bus or wherever, whether you're in the village or in a restaurant in Midtown or in the Bronx. And the idea that there would no longer be this kind of geographic enclaves where you can maybe be free when you go there, but even there have to watch for your safety, and this would be just a normal thing to kiss your boyfriend. So many people who talked, men and women, talked about kissing your partner in public or holding hands in public. And this is in New York City, which is probably one of the most free cities, and this was just like 2 years ago. So it was kind of not surprising, but interesting to read that. And then there was the positive marginality. This is, again, one example. And this is from a woman who said, oppression doesn't just stop things. This is a white woman who laughed. She said, I don't know if I have a life without racism, homophobia, and sexism. I would be 100% different. As I said before, this was a common thing. I don't know, just like I wouldn't be who I am. That's basically what I have to say, because racism and homophobia affect every single aspect of your life. In some ways, I'm almost grateful that I'm a lesbian, because it was sort of the only thing that saved me, for a life of a pretty limited worldview. And you have to experience some things. You're going to have to go through some things, and you got to have strong in some areas to where you're going to get to that point where you're going to have a peaceful mind. And a lot of the things in that positive marginality was about the struggle and survival and resistance that comes out of those experiences. So the basic premise of minority stress theory or approach is basically that simple, that prejudice, stigma, and discrimination directed toward members of socially disadvantaged groups, like LGBT, but not only, bring about unique stressors. As I said before, the idea is that you're exposed to things that are unique in the sense not that nobody else, like for example, can be fired, but you have a unique source for that added experience. And the reason that it's important to think of it as an added experience, because if you think in terms of public health or epidemiology, we always look for added risks. So, for example, smokers have an added risk for lung cancer because they have something that non-smokers don't have. So this is a similar thing where you have more of the experience of stress. It wouldn't be the same if we just said, well, straight people have their own stresses. So again, of course, everybody has stress, and everybody would tell this to me, well, everybody has stress. Yes, that is true. The problem here is to what extent do some groups of people, because of them being member of that group that is experiencing stigma, have more of those more reasons to experience those types of stressors. And then if those stressors cause adverse health outcomes, the groups that are experiencing more of those will have more health problems or more whatever health outcome it is. So the basic premise of this is displayed using the stress model. And the stress model is something very simple and probably familiar to you, if not from reading about it, from living it. Basically, if you experience some kind of stressful event, it can affect your health in various ways. And there's all kinds of research describing the ways that this can happen. It could both happen through biological mechanisms, through the reactions of the body to the experience of stress, as well as through some kind of what we call coping mechanisms that are more negative, like smoking. So smoking as a reaction to some kind of stressful experiences that can then lead to disease due to smoking, but the stress enhances that, leads to that behavior. The other thing about stress model is that it always involves the outcome of disease is the result of two forces, the negative forces of the experience of stress as well as the positive forces of coping and social support. This is a kind of classic stress theory. It's been around for decades now and has been studied for decades and has been shown to have a significant effect on a variety of health outcomes, as I said, either through biological mechanism or through other mechanisms that are not immediately related to the stress response. What minority stress says is that people don't experience stress just randomly. That stress is socially distributed, or that stress or the experience of stress is socially determined. So that people in particular groups, as I said before, might be exposed to more stresses because of where they're situated socially. So this is the whole basically brilliance of minority stress, is just tying it up to social causes. And basically what it says in this example, that sexual orientation, race, ethnicity, and gender are some of those social statuses. They're not the only ones. And they therefore predispose people to stressors that are not only the general stressors that everybody experiences, but those unique stressors that they experience because of their social position. And I've described in research various types of stressors. I never meant for them to be like the only ones that are possible, but I think they're pretty comprehensive. So first, there are the prejudice events. So I described before that those would include the large events, the small events, the non-events, the entire experiences of the effects of stigma on individuals' lives. But there are also other types of stress processes that are tied to this social position that are more difficult to explain because they're not events that happen on the outside. To some extent, they are an effect of the internalization of stigma, of the fact that you grow up in a society where stigma is to be expected in your everyday life. And among those things are, for example, the expectations of rejection. And that's an interesting process because it suggests that really nothing has to happen for a person to have a stress response. And the only thing that happens is the person knows that they might be at risk and therefore they will have a stress response. And a good example of that is something that was alluded in the text before of that respondent who talked about walking down the streets and holding hands. Now, I don't know any neighborhood in the United States, I don't know about here, where two men or two women can walk hand in hand totally free, if it's not Gay Pride Day or something, on a dark street. I actually experienced that myself in San Francisco, where I was walking close to my partner and we were literally being chased on, like kind of we ran away. This was just a couple of years ago. So I think everybody at least has to have some kind of like vigilance as to what is going on around them, just because we know that there's some risk involved in that because somebody might be pissed off at you because you're gay. So that is just a minor example of something that is a daily occurrence. Another example of that I gave is, for example, a woman going to a job interview and she's in a law firm, let's say, and they're all men. Now, these men don't have to be sexist in any way themselves, but the woman will be smart to assume that there are some kind of assumptions about her and about how she's how she's presenting herself, and in particular in the context of employment for women, to what extent she expresses overly feminine attributes or overly masculine attitudes. And she would have to monitor her performance with this kind of like what Freud actually called the third eye, that this therapist has to have to kind of observe what's happening. In the same way, people who are in a minority position, whenever they walk around in any environment that is not kind of a unique minority environment, they kind of have to monitor what's going on. And that experience is exactly reminiscent of the most classic example of stress, which is the fight or flight response, where you have to know whether you run or fight, and which activates an entire stress response, including all the bodily mechanisms that are related to the negative effects on the body. So this is, again, just an example of expectations of rejection that seemingly nothing is going on, and a person who is in a stigmatized or disadvantaged group will always have to have on mind something that another person who is in a majority would not have. So it's basically like this world was created for this other person. It wasn't created for me, and therefore I have to watch how I fit in, what I do and what I don't do. There's a fascinating research, for example, on stereotype threat. I don't know if you're familiar with that show that, for example, black students perform worse when this kind of expectation of rejection is activated in an experiment, whereas they perform compared to when it's not activated. So this is a randomized experiments in colleges. Those are all good students. When you activate this kind of thinking, it immediately affects their performance as in ways that I just described, as it affects us in kind of having to be vigilant, as Gordon Allport called it. The other ones are the effects of concealment, and I can again talk about that for the next 10 minutes, but I won't, and internalized homophobia. Now, I consider both of those, concealment and internalized homophobia, concealment meaning that you don't tell other people that you're gay for various reasons, and internalized homophobia meaning that you internalize attitudes and values that society upholds about sexuality and think those things about your own self if you're gay, as well as the expectation of what will happen to you. So, and this is changing actually rapidly, but it used to be that gay people didn't really think that they can have families. So this was a given. This was like, and to a great extent, it was internalized homophobia. So I don't mean by that to say that there's anything wrong with the people who are either concealing their sexual orientation or who have this internalized homophobia. What I'm describing here, as is described here, is a social process. So sometimes people take concealment to be some kind of an indication of mental health or of coming out success. No, this is all something in my mind that is related to the social environment. So, for example, a gay soldier in the U.S. military until very recently who wasn't out could have been the most wonderful, healthy, and proud gay person, but he couldn't come out because he knew that he would be fired. So those are the kind of things that we're talking about in concealment and internalized homophobia. Now, there's a whole area of how identity is related to all of those things. Again, I'm not going to get into that. There's a lot of research that needs to be done on that. But one example of that, for example, if you have a strong identity as a gay person and you are attacked, is that going to be kind of more painful because it attacks a core identity part of you? Or is it going to be easier because you have greater resources to deal with it? And there's research evidence on both sides of it, and they might be both correct, that there are those countervailing effects. There's also a question about to what extent minority identity is important to activate some of those. For example, if you don't really consider yourself gay, if you're MSM, quote unquote, does it expectation of rejection affect you? Does concealment affect you to that extent? Does internalized homophobia affect you? I think that to a great extent, yes, but those are definitely questions to study. So there are basically two testable hypotheses that we've been studying. Number one is that members of disadvantaged group, in this case sexual minorities, have in fact more stress than members of the advantaged group. And the second one is that they have more disorders, not just mental, but I study mental disorders. And the third hypothesis, which I'm not going to talk about at all today, is whether in fact you see this mediating role for the stress leading or causing those disorders. So those are basically the three hypotheses that you can think about. So I talked about the stress, so I won't say more about it, but there has been surprisingly fewer studies that looked at the exposure to stress, but in one recent study we looked at that and found definitely that gay people have more exposure to stress than heterosexuals. And among gay people, black and Latino men and women have more stress than whites. Again, those are all not very surprising findings, but they had to be verified, because some places there are surprising findings. For example, we and other people have found that women don't have more stress than men, even though women are a disadvantaged social group. They have different types of stressors. So you do need to study those things to explore it. Just because you think something is true is not necessarily going to be shown in the research that is true. But in terms of mental health, certainly there has been now numerous studies for many parts, national studies, community studies, studies in the United States and studies abroad that showed, to me, beyond really any doubt at this point, that gay people have higher rates of most major disorders, which are depression, anxiety, and substance use disorders. There's almost like overwhelming evidence for that, I think. I think most people would agree at this point. The other part, though, that hasn't been studied a lot is what happens among gay groups. And Marina mentioned the intersectionality question that I'm interested in, which is, to what extent being black and gay is somehow puts you in a worse, stress experience than being white and gay. To what extent being a black woman is worse than being a white woman. Where you have intersections of different identity or social positions. So we did that in a study looking at, in the study that I mentioned before, STRIDE, we looked at race, ethnicity, gender. We looked at bisexual identity because there's been recent evidence that bisexual identity is related to certain stressors that gay people don't experience, in part because there's, to some extent, greater place now for bisexuals to, for gay people and lesbians, than there maybe is a space for bisexual identified people. And we looked at age as well, which is an interesting thing, because from a minority stress perspective, you would predict that younger generations of gay people, gay, lesbian, bisexual, when I say gay, I mean LGBT. I didn't talk about transgender because that study didn't include them, but we can talk about it later. But the theory would apply, but the research evidence doesn't. So the age that younger generations, people who grew up, when things were better, the social environment was better, that they should do better in terms of the outcome. So we looked at that, which would be kind of interesting, because in the general population, at least in the United States, younger people have more disorders. So we wanted to see whether gay groups, young cohorts, are more like the general population of people where there's an age effect, or younger people having more disorders, or whether they would be more like what minority stress theory would predict, that because they had a better social environment, especially the younger ones, they might have had less exposure to stress and therefore less disorders. So we looked at, first of all, just looking at the right column on there is one of the major studies in the United States that looked at mental disorders. And what I show you here is differences between men and women in the STRIDE study, which is my study, compared with the general U.S. population. And these differences are pretty consistent with what many other studies have shown, where you see usually about a twofold increase in the rates of disorders in gay and lesbian and bisexual populations. So you see the overall rates for anxiety disorders, MDD is major depressive disorder, any substance use disorder, which includes drug and alcohol. And in this case, we also look at bulimia nervosa, which is eating disorders, which has been theorized a lot about. And what people thought is that maybe gay men have more than straight men, certainly, but maybe lesbians have less because they are not subject to the male gaze. But I think that theory is not certainly supported by this evidence that shows that both gay men and lesbian have higher rates of disorder, which is consistent, again, with the stress theory. So in terms of our outcomes, looking at race ethnicity, we found something surprising from that stress theory perspective. So now we're looking only at gay people, so this is within the gay groups. We're not comparing it with straight. And what we saw here, these are odds ratios, and an odds ratio that is greater than 1, let's say of 2, would say that the group is about twice as likely to have the disorder. An odds ratio that is less suggests that the group is less likely to have the disorder or has less of the disorder. And the ones that are highlighted here with the orange or whatever color it looks to you like are the ones that are significant. Those are usually, in terms of odds ratio, ones that don't include the number 1 in the range. So if it's 1, it means it's just as. And what you see here, that surprisingly blacks actually have less disorders than the white gay men and lesbians. And Latinos have just about the same. You see it's around 1. So this is surprising because it's counter to my theory, but it is not as surprising because we find the same thing in the general U.S. population, where blacks, despite having more stress, definitely due to racism, have actually fewer disorders than whites. And this is one of the greatest kind of areas of research now, where people investigating all kinds of theories that I can describe later, but there's really no answer to why that is. Men and women, we found no differences. This is somewhat different than the general population studies, where women have more depressive disorders but fewer substance use disorders. In this case, we found that lesbians and gay men have the same rates of both. And they're both higher than the general population, as I mentioned before. In terms of bisexual identity, we did find that bisexuals have more substance use disorders. And in terms of the age group, we did see that some suggestion that the younger groups are less likely to experience mood disorders than the older cohorts. So this is consistent with the theory. But interestingly, one of the other findings, by the way, is that, and that I'm sure you've heard a million times, is that gay youth are more likely to attempt suicide than straight youth. And this is one of the fascinating findings for me in our study, looking at the white men and women, black men and women, and Latino men and women, which are all gay, that despite what I just said about blacks and Latinos having less depression, having less of most of the disorders, they reported more suicide attempts. And we looked at the age when this suicide happened, and it was consistent with the idea that it has something to do around sexuality. So we're looking into this as to why this is the case now. You see that for suicide attempt, both blacks and Latinos had much higher rates than the whites. And in the age group, we did see that somewhat, I think, encouraging idea that there is a reduction with more recent cohorts of gay and lesbian people than older cohort. Of course, that still doesn't mean that it's good, because the gay and lesbian kids continue to have much higher rates of suicide than straights, but there's some progress. There are also many studies that looked at physical health outcomes. For example, in the same project, we looked at people who had one or more prejudice-related stressful experiences, and we found that they were about 3 times more likely than those who didn't experience a prejudice event to experience at least one serious physical health outcome. And by the way, this was even when we controlled for any other type of event. So controlling for all the events, the specifically prejudice-related events has an increased risk for physical disorders. In terms of concealment in another study by Cole, which many people quoted, was shown to affect both survival from HIV and among HIV-negative people, a variety of health outcomes. So that is people who conceal their sexual orientation compared to gay people. This is all men, because it was usually in the context of HIV studies. The men who concealed were actually died earlier from HIV, and those who were HIV negative who concealed were less healthy than those who were out, so to speak. Exposure to discrimination is also related to outcomes such as the number of sick days and number of physician's visits. And this minority stress has also been studied related to risk behavior. So, for example, internalized homophobia, discrimination, and expectations of rejection, those stressors that I mentioned before, was associated with HIV risk behavior in one study. And in terms of the mechanisms of why these risk behaviors, one study looked at it suggesting that maybe internalized homophobia was related to a certain fatalism. As I said before, internalized homophobia has to do with internalizing expectations. And to the extent that people with higher levels of internalized homophobia thought that, gay people just die from AIDS, and they internalized that, they therefore were less likely to protect themselves due to fatalism, according to this one study. So I want to make 2 points by way of discussion, which is really more than a discussion, but suggestions for kind of future studies. So one area that hasn't been unfortunately done enough of is using this minority stress model to think about intervention and prevention. Like, how do we move from understanding those things to actually preventing them and intervening? And I owed this to my colleague Suzanne Roulette, who described this, how you can look at a model, a stress model, and begin to chart areas for prevention and intervention based on your understanding of the causal mechanisms. And as I tell my students always, having a model is good even if you don't or can't do everything that you can see in the model. It's just because it points out to you what areas you can't do or you're not doing when you're addressing something. So I'm not saying here that there's necessarily a hierarchy that many people in public health, let's say, think, it's better to do upstream intervention than downstream intervention because they affect more globally, more ecologically. I don't necessarily think that that's always the case, because at any given time you have to do anything you can do, usually. You can't just wait until heterosexism is abolished and then move on. So, but it is important to think about the effect of legislation and education in affecting the social positioning of minority groups. And I say minority, I know that gender is not a minority group, but I use this term sometimes. In terms of the actual, for example, prejudice, violent, anti-gay violence, policing and persecution of crimes, and we talked about the bullying, where there's been like an ongoing discussion with, surprisingly to me, rejection of the idea that gay kids should be protected in schools, because, as some people in that commission said, this silences religious kids who think that being gay is bad. So even in something that would seem so simple as protecting kids in school, there is opposition, to me, shocking. But another area is what kind of things we can do to enhance the coping and social support aspects. And again, I didn't talk about it in this presentation, but there's a lot of work and a lot of studies that show the positive impact of, for example, being identified with your community, of gaining more positive role models, of removing or overcoming some of the internalized homophobic ideas that you learned maybe as a child or maybe as a religious person. So how can we enhance that through community groups, through some of the work that you all do, for example? In terms of things like internalized homophobia, what are some of the mental health prevention counseling in schools, for example? When I talked at that bullying, the U.S. Commission on Civil Rights, I said that it is not only enough to ensure that gay kids have a safe environment, it also have to be a supportive environment. And you can imagine that those people who objected to the idea of even protecting gay kids really had a field day about the idea of giving them a supportive environment where we actually support them coming out as gay kids. The idea, even in what we call tertiary prevention, which is kind of like when a person is already affected, when you give them treatment, again, we have to think about sensitive and accessible mental health services and in general health services. We know, for example, that gay people are less likely to have access to health care. in large part, because when they have partners and one partner doesn't work, many times the partner may not be eligible for health insurance coverage. So these are some of the areas that we can think about in terms of prevention. And finally, in terms of further work, there's been suggestion, which I agree with, that and unlike Terry's more pessimistic opening, I'm a lot more optimistic about how much change has happened and is going to be, and I feel like it's clear that we are already on the path to greater and bigger and better changes. Although I share your concern that. And I think it's important to remind people, changing laws do not change attitudes and do not eliminate. In the U.S., the Civil Rights Act was in 1964. That didn't eliminate racism yet. So we shouldn't be overly optimistic and should continue to think about what we need to do. But at the same time, there has been incredible changes, of course. So there's been an idea by Rich Savin Williams, for example, and other, that is now gay youth who are kind of have an environment that is so accepting, there is not even an issue for them, and we're in a kind of post-gay world where it doesn't really matter that you're gay, you're just like anybody else. I don't believe that. I think that there are significant changes. I think there are changes in the way gay kids experience homophobia. One example for that, I think, is most gay kids, many gay kids now more than before come out at very young age, which on one hand is a wonderful thing to see, and on the other hand it's also a dangerous thing for many of them because they are subject to more harassment and violence. We know that from many studies that being out is related to greater experiences of violence, for example. So this concealing your sexual orientation is in fact a coping mechanism in some ways. It also has very damaging effects, but it also does protect people from violence, for example. So what is the role of minority stress theory, or how do we think about it within the context of a world where in fact there has been changes, and where do these stressors fit into the life of, for example, gay kids? One thing I've learned, for example, and I don't know if you find that here as well, I talked to Bert Kohler in Chicago, and he said they no longer have in the community center coming out groups, which used to be a staple of gay community centers. You know what a coming out group is, where kids used to come and talk about coming out. And he said they no longer have that. Nobody comes to those kind of meetings anymore. So there has been changes, but it doesn't mean that we can close shop. I think the question is, what do we need to think about now? For example, I worry about, as I said, exposure to violence because kids are out, rejection by their families, and I worry about what happens when they move into the workforce, where they maybe have certain expectations about being treated equally. Youth in the United States definitely have more accepting attitudes than older people. So what happens when a young guy or woman from college move on to the work environment and they realize that everybody is not like their college peers and maybe even college professors? So there are all kinds of questions I find in terms of thinking about the younger group of people as they come out and as they experience the world that is changing but has not completely changed yet. Thank you.